Welcome back. Now, in the second part, in continuation of the first part regarding the basics of barium studies, we'll proceed further. And to begin with the second part, the basics of barium study, this is just remember this slide, a very important slide. The basic slide we would like to go in every part we are supposed to discuss here. Now, we are taking up with the first spectrum entity, that is barium swallow. These are the 5 basic spectrum of barium studies, and we are taking up the first one, that is barium swallow. Now, barium swallow, the area it is covering is, just remember, from oral cavity to fundus of stomach. The oral cavity to fundus of the stomach. If any patient is presenting with any disease process or lesion that is involving any site starting from the oral cavity up to the fundus of the stomach, and for documentation as well as an aid to the diagnostic process, if this facility is available and if there is clear-cut indication of going with this investigation, we must order for barium swallow. And just remember, these barium studies, they are very useful whenever we want to see some physiological phenomenon or the functional aspect of any organ. For example, what is the condition of the lumen of esophagus, or regarding the peristaltic waves in the esophagus or the stomach. So these functional aspect we can very well visualize over these barium studies. And the structural aspect as well as sometimes the functional one also, that can be nowadays. Another option available is contrast enhanced computerized tomographic scanning with 3D reconstruction, 3D CT reconstruction, as well as the endoscopy. So these two things are also available nowadays. But yes, for functional aspect, the physiological aspect, the barium studies are very good. So this barium swallow from oral cavity to fundus of stomach. And what is the preparation before going for this barium swallow? We are just discussing the important points here. Patients should be having at least 4-hour fasting for this study, and advise the patient not to smoke. These two advices at least must be there for this barium swallow study. And patients, any patient who's requiring this barium swallow study, he or she may present to us with dysphagia or odynophagia or heartburn or fullness of epigastrium or fullness in the chest. I suppose that you must know, you may be knowing the various, what is dysphagia, what is odynophagia. Very quickly, dysphagia is difficulty in swallowing. Odynophagia is the painful swallowing. Heartburn, you know. The fullness, yes, you know that. What is fullness? So these are the basic symptoms with which one of the patient may present to us, either one of the symptoms or a combination of these symptoms. In these patients, if indicated, if the disease process is requiring further investigation, the diagnostic one, we can order the barium swallow. To be more specific, the indications of barium swallow, if we are suspecting the high or low dysphagia, if something is there in the upper esophagus or the pharynx, or the mid part of the esophagus, or the gastroesophageal junction, if some swelling is there, or if something is there that is hindering the function of the esophagus, this barium swallow can be one of the option. Another condition for barium swallow could be the globus pharyngeus. Now this globus pharyngeus is a condition where patient is having a painless sensation. Painless sensation of what? Painless sensation of a lump that is present inside the throat. This is globus pharyngeus. Patient will say, I'm having some lump sort of thing, or difficulty there, or something is there inside my throat, and that is painless. This painless sensation, the condition, is known as globus pharyngeus. Now, if suppose the patient is having some fistula, any communication between trachea and esophagus, the tracheo-esophagus fistula. But be cautious in this thing. The other way around, the assessment of fistula, if these pharyngocutaneous fistula is there, or esophageal cutaneous fistula is there sometimes in difficult cases, the gastrocutaneous fistula is there. In these cases, this barium study is indicated. But in cases of tracheoesophageal fistula, it should be avoided. Why? Because there is risk of aspiration, right? So remember, assessment of fistula doesn't mean tracheoesophageal fistula. Usually, this barium, as this is having a very high density and thick viscosity, and there is risk of aspiration in barium, what we have discussed in the first video, so it must be avoided in tracheoesophageal fistula. But yes, for pharyngocutaneous or esophagocutaneous or gastrocutaneous or enterocutaneous fistulas, yes, these studies are indicated, right? As we are talking about the barium swallow, we'll confine ourselves to the study of oral cavity, the esophagus, and the upper part of the stomach, that is fundus of the stomach, because the swallow is for oral cavity up to the fundus of the stomach, right? The third is if the patient is suffering. The fourth one is if the patient is suffering from gastroesophageal reflux disease, also known as GERD or GORD. In that case also, this barium swallow can help us. And whenever we want to assess a case of hiatal hernia, during the assessment of a hiatus hernia, this barium swallow is indicated. If the patient is presenting with generalized epigastric pain and rest of the thing almost normal, the ultrasound is not suggestive of anything, patient may be having some functional aspect or may be having some early stage disease. To rule out that, this barium swallow is required. So any patient presenting with epigastric pain generalized without any obvious cause, this is one of the investigation that is available for assessment. If patient is presenting with persistent vomiting, barium swallow is indicated. And if we are unable to pass the endoscope during upper GI endoscopy, if we are unable to pass the endoscope due to some stricture or due to some difficult distal passage, this barium swallow is indicated, right? As in the case of this achalasia. Okay, we have already discussed this 7 important indications, the group of indications for barium swallow. Now, there are 3 important contraindications for barium swallow. off, I have already told you the tracheoesophageal fistula, avoid it, this barium swallow. If we are suspecting some perforation in esophagus or the stomach, the upper part, or even the antral, avoid this barium swallow. Don't order for barium swallow. So perforation, tracheoesophageal fistula, and paralytic ILS. These there are three important contraindications for barium swallow. Usually what happens in barium swallow, usually this investigation start in erect position for the patient, and to on image to clear the esophagus from the spine, usually the right anterior oblique position is preferred. We give 10 to 15 ml of barium suspension initially to the patient in the form of bolus, and this bolus is to be followed under fluoroscopy. Now fluoroscopy is again a technique of imaging the tubular organs along with the contrast. It uses X-rays in high intensity, and this fluoroscopy visualization is required for barium swallow, right? Another important thing, if we want to just visualize the pharynx, the part of the oral cavity, the posteriormost part, the pharynx, after giving the patient around 20 ml of thick suspension, this can be visualized, and sometimes we can ask the patient to do Valsalva maneuver. You must be knowing it. And we can ask the patient to say something, or phonation is utilized during the examination of barium swallow. Usually frontal and lateral views are taken, and the hide bone and up to the highest tonsillar fossa, that is the side usually covered in barium swallow, and it looks like something like this. Is the frontal view. The opaque things you can see here, the impression of this, the tongue, the vallicula, the hide bone impression here from this side to this side. On the right side you can see the hide bone impression here, and this is arytenoid cartilages on both the sides, right? This is a frontal view, and if we can subtract the other things, it will look like this, the same frontal view, the vallicula impression with arytenoid cartilages on left and right side and left side. Okay, in lateral view the same thing, the barium swallow. These are the usual findings. Here you can see the tonsillar fossa just by the side of the tongue, the pharynx area, and this is vallicula, right? Now, as in the first video we have discussed, there are three possible patterns, that is mucosal relief view, the single contrast view, and the double contrast view. Now the same thing, these three views under barium swallow, we are just taking up very quickly. The mucosal relief or coating view, whenever esophagus is partially collapsed, we can very well see the longitudinal folds that is present in the esophagus. And whenever these longitudinal folds, they are going to contract, and longitudinally oriented muscularis mucosa, the fibers are contracting, they form the transverse folds, as we can see in the gastroesophageal reflux disease. Then this mucosal relief coating view is required. As you can see here, longitudinal folds here in these two one, and in the last one you can see the transverse pattern here due to contraction of longitudinally oriented muscularis mucosae, the fibers, right? Here you can see I think you can appreciate here transverse folds. So this is mucosal relief view. Small amount of barium is used. Then the single contrast. For esophagus, 40 to 50 ml of barium suspension is given to the patient, full in mouth. The position is supine, and whenever distended esophagus is there, the right anterior oblique erect view is taken, and in collapsed esophagus, the dense barium coating is there. Single contrast is there, no air or CO2 is used in this one, and it can show the esophagus like this. You can see here the single contrast. Everything is opaque due to barium, and X-rays cannot pass through this contrast, and that's why this picture is there. This is the esophagus, the lumen, right? Single contrast. Now the barium double contrast. Initially we are going to give high density 15 to 20 ml of barium suspension, and after that we'll give the effervescent as I have discussed in the first video. If you have not gone through the first video, kindly go through it for better understanding. And so high density barium 15 to 20 ml initially, followed by effervescent. The position of the patient is usually erect or prone. In these type of patients, while doing double contrast, we usually give Buscopan IV sometimes to induce hypotonia in the esophagus, right? And it facilitates this barium double contrast study. Usually the frontal, lateral view or right anterior oblique view is taken. These are the various views that is recommended during barium double contrast swallow study, barium swallow. Indications we have already discussed. Here you can see the esophagus, the presence of the air, more specifically the CO2, this one, and the opaque one, the barium lining, right? Here is the diaphragm. This is the hiatus with this esophagus enters the diaphragm opening and it goes inside the stomach, this area. It goes inside the peritoneal cavity. What is the normal impression of the esophagus on barium swallow? This is something like this. This is seen after taking a simple X-ray under fluoroscopy. And these are the ribs, you can see. This one. And here somewhere here the vertebral column is there. And this is esophagus. This is the constriction. There's a entering the esophagus enters the diaphragm and goes in. This is the intra-abdominal part of esophagus, this one, the lowermost, and this is the impression of arch of aorta here. This is normal impression over barium swallow, and this is abnormal one. You can see something is being pressing over the posterior wall of the esophagus. This is extrinsic posterior compression from some swelling from the posterior aspect, and this is esophagus. So advantage of doing this double contrast study is this one, right? We can identify even the extrinsic compression also. Now in barium swallow, the basics we have discussed. What is a normal impression of the esophagus and what is the abnormal one we have discussed. There are few special conditions where we would like to modify the imaging, the barium swallow imaging. We are supposed to modify, and these are the basic important conditions that do 6 in number. Usually the commoner one I'm just discussing here. There are 6 conditions where we are supposed to modify something during barium swallow study. Let's go one by one. If we are suspecting some perforation beforehand, or if the patient is in such a condition that there is risk of aspiration, then what to do? we'll have to modify something. So first condition is suspected perforation or risk of aspiration is there. If there is foreign body, the second condition. The third condition, if there is hiatus hernia, or if there is varices, esophageal varices, in cases of portal hypertension associated esophageal varices are there, or if there is features suggestive of gastroesophageal reflux disease presenting as reflux, and in various esophageal or the other disorders that is related to the motility of esophagus, the motility disorders. So these are the 6 broad groups where we are supposed to modify the imaging. How come? Very quickly we'll go through this. If there is suspected perforation or if there is risk of aspiration, don't use barium. Barium is very thick, very high density, and sometimes if patient is going to aspirate during the barium study in these group of patients, it may reduce the function of respiratory tracheobronchial passage, and sometimes in very rare instances it may lead to death also. So in these group of patients, don't use barium. The better option could be the gastrographin, and this gastrographin is water soluble contrast. Although it is ionic, but this gastrographin can be used. Another option is gastromiro if it is available. This is non-ionic contrast. So these 2 options are there instead of barium, and we must not use barium in these cases if there is suspected perforation or if there is risk of aspiration. If we are suspecting foreign body, instead of giving barium suspension, the marshmallow or cotton coated or bread coated in barium, this is the thing we must use as contrast material in case of foreign body. Rest of the things almost same. If we are suspecting hiatus hernia, usually ask the patient to strain to raise the intra-abdominal pressure to amplify the hiatus hernia, to clearly diagnose it or having a more clear picture of hiatus hernia. So straining is important in case of hiatus hernia. If there are esophageal varices, usually single contrast mucosal relief pattern is required, and in this case high density barium we are going to use. Patient is in prone right posterior oblique position, and Buscopan IV is given to make the esophagus atonic to enhance variceal filling. We want to make the varices prominent so that they can be clearly diagnosed and assessed. So Buscopan IV is required to make the variceal filling more. After giving Buscopan, usually the esophagus muscles they are atonic. And sometimes we can ask the patient to do Valsalva maneuver. Just close your nostril and the mouth and just try to balloon it up. And that Valsalva maneuver, you must have gone through the ENT postings, right? And the varices looks like something like this. This is the esophagus. There's the ribs, the posterior part, and these the spaces, the dark one, these are esophageal varices, presence of esophageal varices. If patient is having reflux and we are suspecting gastroesophageal reflux disease, usually the patient drinks barium through a straw, left posterior oblique position, and what we are going to do, we are going to take spot films of lower end of the esophagus as well as the gastroesophageal junction, and it is taken during the distension of this site when barium passes through it. And this is usually the picture what we get in GORD. Not very clear, but yes, the reflux is there. And finally, the motility disorder. Usually, the barium swallow is done in lying down position by the patient, and patient is asked to take single swallow at a time to check for motility. First 5 swallows are monitored to evaluate motility. Just monitor the first 5 swallows, how the motility of esophagus is going on, whether it is hampered or not, what is the severity. And for there is a test that is known as amyl nitrite test. This I'll come to this. And whenever we are going to give amyl nitrite, the streak of barium may pass through it or may not pass through it, depending on the type of disease what the patient is suffering. So amyl nitrite test is there, and this is the dilated part of the esophagus, and this is just nearer to the gastroesophageal junction, and this is the narrowest area of this esophagus, and thin streak of barium is passing through it. You can see. Now, what is amyl nitrite test? Very important thing. If amyl nitrite we are giving through inhalation, it seems to distinguish the patients with pseudoachalasia and idiopathic achalasia. Pseudoachalasia means features of achalasia is there, but that is not true. That is because of some other disease. That's why patient is presenting to us with features of achalasia. For example, in motility disorder, if the lower part of the esophagus is being infiltrated by some tumor of the distal esophagus, some tumor is there affecting the distal esophagus, infiltrating the wall, then this is known as pseudoachalasia. The cause is that tumor, not the true achalasia. The narrow lower esophageal sphincter segment, this is usually unaffected by the smooth muscle relaxant effect of amyl nitrite. We have administered amyl nitrite through the inhalation route, but in this group, pseudoachalasia group, the lower part of the esophagus is not being relaxed. No effects there. It means it's a case of pseudoachalasia. We must consider endoscopy, go for biopsy if required. In contrast, in cases of idiopathic achalasia, achalasia is there, cause is unknown, the amyl nitrate is going to cause a measurable increase in sphincter diameter. It is going to relax that particular part in idiopathic achalasia. In pseudoachalasia, no effect of amyl nitrate. So this amyl nitrate can be utilized to differentiate between pseudoachalasia and idiopathic achalasia during barium study. This is one of the clinical use of this barium swallow in these group of patients, the motility disorders of esophagus. So that's all in this video. To be continued in the next video. We'll discuss. See you there. Again, if useful, click the right lower hand corner icon and subscribe, share and like to promote the learning. Thank you and namaste.